Hello, dear friends. If you're watching this video close to when it's released, you know that we are in the summertime in the Northeast. This means more fun in the sun and longer days outdoors. Essential oils can be a wonderful ally for the summertime. They can assist with keeping our spirits uplifted, boosting our mood, aiding in more restful sleep, and in keeping various annoying pests and vector-infecting critters away. However, there are some essential oils that aren't the best of friends to our skin when we venture outside. So today, our clinical tip will focus on the subject of phototoxicity. You've probably heard the term phototoxicity if you've been in the essential oil sphere for a little while, and it can sound super scary, but thankfully it's not fatal. But it is unsightly and can cause skin damage and emotional upheaval. So, what is phototoxicity? Lindsay Elmore, a pharmacist and essential oil expert, previously wrote a post on this topic, and she reported that phototoxicity is a type of allergic reaction where a chemical substance increases the sensitivity to ultraviolet light. Furanocoumarins, I'm going to say FC for short, so I don't have to keep trying to pronounce furanocoumarins, but these FCs are found in some essential oils and they squeeze between the base pairs in the DNA. When they're exposed to UV light, the FCs form covalent bonds with DNA. This cross-links the DNA, and this cross-linking causes an inflammatory response. This creates the redness in the skin, a sunburn, and in severe cases, even blistering. And unlike regular sunburn, phototoxicity reactions are sometimes delayed for several days, and the change of color to the skin can last for weeks, if not months. I personally learned about the woes of phototoxicity the hard way, not once, but 2 times. Some of us are slower learners. I experienced a reaction between the FCs and lemon essential oil with a cross-linking of the DNA in my skin cells from the sun on the beach in Italy and on a lake paddleboarding. Let's just say I didn't wear shorts either of these 2 summers because I had slathered the lemon oil all over my legs. Hopefully, this video will spare you from having to go through a shortless summer. All right, if we look more at photosensitivity, phototoxicity, and photoallergy, according to skincancer.org, this phototoxic reaction is a type of photosensitivity, which also encompasses photoallergic reactions. An excerpt from Chapter 97, Phototoxicity and Photoallergy in Fitzpatrick's Dermatology textbook, dug deeper into the distinctions. Photosensitivity to exogenous agents is broadly defined into phototoxicity and photoallergy. It's caused by a topical or systematic agents that absorb ultraviolet A radiation. Phototoxicity occurs in anyone exposed to sufficient doses of phototoxic agent and UV radiation. It usually manifests as an exaggerated sunburn reaction, what we just talked about. Photoallergy is an immune reaction to a UVA-modified chemical, commonly topical sunscreen agents and antimicrobials in the United States and United Kingdom, and topical nonsteroidal anti-inflammatory agents in Europe. It presents as eczematous eruption on sun-exposed areas. Phototoxicity and photoallergy do occur in patients with skin of color, frequently resulting in post-inflammatory hyperpigmentation, which means exaggerated pigmentation of the skin. So to summarize, photosensitivity can be divided into 2 parts. We have phototoxicity, which is the interaction between the FCs and essential oils with our DNA, leading to an inflammatory skin response. And then we have photoallergy, which is an immune-mediated response triggered by UVA light, which causes a form of dermatitis. Now back to the subject at hand, phototoxicity. So now that we know that why we should be cautious of FCs, let's learn more about them and which essential oils contain them. Tisserand Institute states that there are quite a few FCs, and their phototoxicity varies from negligible to potent. FCs are only present in very small percentages in these essential oils, usually less than 1%, but even 0.1% can be phototoxic. FCs are primarily found in 2 plant families, Apiaceae and Rutaceae. though a few Astraceae, Moraceae, and Fabaceae species also contain them. In layman's terms, the phototoxic reaction is most often seen in expressed citrus oils of the Rutaceae family, which contain these FCs, but there are others. Commonly known photosensitizing essential oils include angelica root essential oil, bergamot, bitter orange, cumin, fig leaf absolute, grapefruit, lemon, and lime. All of these are cold pressed if they are citrus. Mandarin leaf, Opanax, rue, and Tagidus. And that's from the Aroma Web, but there are additional lists from Institute in NAHA, and I will provide the links in the transcript in the video description. Now, how do we determine the severity of the reaction of this phototoxic response? According to Tisserand Institute, the severity depends on 5 factors: the amount and potency of the phototoxic chemicals consumed or applied, the type of topical application, whether it was a leave-on or wash-off, the time elapsed since the application or consumption, the intensity and duration of the UV radiation, and a person's skin's phototype. So if we want to prevent this reaction and prevent the severity, we want to take some certain precautions without harming our skin. So these include being aware of what essential oils cause a phototoxic reaction, which we just went through. And again, you will have the comprehensive list available in the transcript in the video description. And then covering the application area. If you happen to go outdoors and say you forgot to wait, which brings us back to waiting 12 to 18 hours before exposure to the sun if the oils were applied. And then you can also dilute photosensitive oils when it's applicable. The phototoxicity associated with these oils that contain FCs is avoidable if they are diluted in lower concentrations. They're less likely to cause a phototoxic reactions. There's a couple of caveats. If you're combining multiple oils, the math gets pretty complicated. And if you are sunbathing, just don't use these oils because that's too risky. Again, there is another chart that lists some of the phototoxic oils and the proper dilution rates, and that will be available again in the transcript. Now, as far as ingesting citrus oil, some people like to combine a little, say, liquid stevia, vitamin C powder, and some essential oils in their water, or maybe they're taking them in a capsule if they're ingesting them because maybe their essential oil naturopath has them on a certain medicinal protocol to help support their mind and body. The actual risk of the FCs causing a reaction based on ingestion is pretty low. The bioavailability and the amount needed is going to be lower because of how fast they exit the body through ingestion. They're gone with 20 minutes is usually a peak from the evidence we have so far from lavender oil, and they're usually out of the body within a few hours. Now, an article on Aroma Web summarizes the usage recommendations per Robert Tisserand and Rodney Young, who wrote the most quoted and most authoritative book on essential oil safety. They stated that there is generally no phototoxic risk if the oils are used in a product that is either not applied to the body or is washed off the skin, such as shampoo, bath preparation, or soap. However, essential oils can adhere to the skin if used in a sauna or steam inhalation. There's no risk if the skin to which the oils are applied is covered in such a way as to prevent UVA radiations from reaching them, and that they recommend that the skin treated with phototoxic oils at levels higher than the maximum use levels should not be exposed to UV light for 12 to 18 hours. So, bottom line, if you're going to use these oils, I think the simplest way to prevent an issue is to just wait 12 to 18 hours before you go out in the sun, or just cover up that body part that you apply topically. We don't want to demonize oils with FCs because they have therapeutic properties. The FCs in themselves tend to be anti-inflammatory, anti-tumoral. They lower blood sugar into healthy ranges, and they can support bone health. So again, we want to use our essential oils, but use them safely and use them mindfully and with love and intention. So that's what I wanted to share with you today in our clinical insights. Now that you have the information you need to enjoy essential oils in the summertime and keep your skin safe and healthy, I hope you do. And all the links and resources will be provided in the video description in the transcript, so be sure to check those out. And then you can also post your own experience with using essential oils during the sunny seasons. Let me know if I'm not the only person that decided that I was above the safety instructions in Italy and paddleboarding. And I want to just thank you for listening, and I hope that you take gentle care. And I'm always open to suggestions on the next clinical tip if you have a subject you would like me to review.